Did you know that nearly 1 in 3 adults have fatty liver disease, and most of them don't even know that they have it? Fatty liver disease is one of the most common liver conditions. However, it is often overlooked by many until it becomes a serious health issue. So, in today's video, we will explain in depth what fatty liver disease is, what causes it, how to spot the symptoms, and how it can be treated. So, what are you waiting for? Let's get started. First, let's understand what fatty liver disease is. Fatty liver disease, also known as hepatic steatosis, occurs when excess fat builds up in the liver. While it is normal for the liver to contain some fat, when fat makes up more than 5 to 10% of the liver's weight, it is considered fatty liver disease. There are 2 types of fatty liver disease. Number 1 is non-alcoholic fatty liver disease, or NAFLD. This is the most common type of fatty liver disease. It occurs mostly in people who drink little or no alcohol and is often linked to metabolic issues like obesity and diabetes. Number 2 is alcoholic fatty liver disease, or AFLD. Alcoholic fatty liver disease, also known as alcoholic steatosis, is a liver condition that occurs as a result of excessive alcohol consumption. It is one of the earliest and most common forms of alcohol-related liver disease and can range in severity depending on the duration and amount of alcohol intake. Whether it is alcohol-related or non-alcoholic fatty liver disease, both conditions can pose serious health risks. But what are the factors that lead to fat accumulation in the liver? So, let's take a closer look at the causes of fatty liver disease. Fatty liver disease can arise from various causes. Understanding these factors is important, as it can help you determine your risk and guide you toward preventive measures. So, without any further delay, let's begin. Number 1. Obesity and overweight. Obesity and being overweight are among the major contributors to fatty liver disease, especially non-alcoholic fatty liver disease. This is because when you have excess body weight, particularly around the abdomen, the liver is more likely to store extra fat. This could be due to many reasons. One reason is that obesity often causes insulin resistance. This means the body's cells don't respond properly to insulin as well as they should, which results in higher levels of insulin and glucose in the blood. These elevated levels can cause more fat to be stored in the liver. Additionally, excess fat, especially visceral fat located around the organs, can lead to inflammation in the liver. This inflammation may progress and cause more severe liver conditions, such as steatohepatitis, which is a type of fatty liver disease that involves liver cell damage. Moreover, obesity is also a key part of metabolic syndrome, which is a group of conditions that includes high blood pressure, high blood sugar, and abnormal cholesterol levels. Each of these conditions can further increase the risk of developing fatty liver disease. A study also found that obesity significantly increases the risk of developing fatty liver disease, particularly in individuals with a body mass index over 30. So, these are the ways obesity can cause fatty liver disease. Number 2. Insulin resistance and type 2 diabetes. Another major reason for fatty liver disease is insulin resistance, often associated with type 2 diabetes. As mentioned earlier, when your body is resistant to insulin, it means that it is struggling to manage your glucose levels, and this can lead to an accumulation of fat in your liver. In fact, a famous research study suggests that over 50% of people with type 2 diabetes can have NAFLD, which makes it a critical area of concern. Number 3. High cholesterol and triglycerides. If you have high levels of cholesterol and triglycerides in your blood, then it can also cause you to develop a fatty liver disease. This is because excess of these fats can accumulate in your liver, which eventually leads to hepatic steatosis. In fact, many studies have suggested that individuals with high triglycerides have a higher risk of developing fatty liver. Number 4. Excessive alcohol consumption. If you consume excessive amounts of alcohol, remember that this behavior is the primary cause of alcoholic fatty liver disease. This is because the liver plays a vital role in metabolizing alcohol. When you drink, the liver breaks down the alcohol into various substances. However, this process produces harmful byproducts that can damage liver cells over time. As the liver continues to process large quantities of alcohol, it can become overwhelmed by these toxic substances. This damage often causes inflammation, a condition in which the liver becomes swollen and irritated. Additionally, the liver may begin to accumulate fat, leading to a buildup of fatty deposits in its cells. So, this is the way alcohol consumption can cause fatty liver disease. Number 5. Poor diet. Poor diet is another important factor that can contribute to fatty liver disease. If you eat a diet high in processed foods, sugar, and unhealthy fats, it can cause fatty liver disease. This is because processed foods often contain trans and saturated fats, which cause inflammation and oxidative stress in liver cells. Moreover, excessive fructose intake, commonly found in sugary drinks and snacks, can increase fat production in the liver, which promotes fat accumulation and insulin resistance. Number 6. Sedentary lifestyle. If you are living a sedentary life, then it can also increase your chances of developing a fatty liver disease. This is because if you lack physical activity, it can lead you to gain weight and increase the risk of factors that can cause the accumulation of fats in your liver. And there you have it, the causes of fatty liver disease. But how will you know if you have fatty liver disease? Let's have a look at the symptoms of the disease too. The dangerous aspect of fatty liver disease is that most people with this condition don't experience any symptoms, especially in the early stages. However, as the disease progresses, certain signs and symptoms may begin to appear. These signs and symptoms serve as initial indicators of the disease. Let's discuss some of the main ones. Number 1. Fatigue. One of the most common symptoms of fatty liver disease is persistent fatigue. You will feel tired. But this tiredness is more than just feeling sleepy or having less energy. You will feel a deep and chronic exhaustion that will not go away even with proper rest. This fatigue can arise from several factors. First, as the liver struggles to perform its essential functions, such as detoxification and metabolism, energy levels may decline, which can cause feelings of exhaustion. Additionally, inflammation in the liver can trigger the release of chemicals known as cytokines, which contribute to fatigue and a general sense of malaise. Nutritional deficiencies can also play a role. Individuals with fatty liver disease may have difficulty absorbing essential nutrients, resulting in a lack of vitamins and minerals that further exacerbate tiredness. Number 2. Discomfort or pain in the upper right abdomen. The second symptom on our list that you can have in fatty liver disease is you can feel a dull ache or discomfort in the upper right side of your abdomen. The pain will be particularly in the area where your liver is located. This happens because the liver becomes enlarged or inflamed due to fat accumulation. Many people mistakenly assume this pain is for digestive issues or gallbladder problems, but this is among the initial indications that you are developing a fatty liver disease. Number 3. Unexplained weight loss. If you are losing weight without trying any exercises, then it can also be a sign that your liver is in danger. When your liver becomes more damaged, then it can affect your metabolism. So, it causes unintentional weight loss. This is because as the liver becomes increasingly damaged due to conditions like fatty liver disease, its ability to metabolize nutrients effectively can be compromised. This disruption in metabolic function can lead to unintentional weight loss, as the body may not properly process or store nutrients. Number 4. Jaundice. This is a symptom you will notice in more severe cases. In such cases, your fatty liver disease can lead you to jaundice, where your skin and the whites of your eyes will take on a yellowish shade. This occurs because your liver is unable to process bilirubin, a byproduct of red blood cells, and it's a waste product that your liver processes and eliminates from your body. Number 5. Swelling in the legs and abdomen. This symptom typically arises as fatty liver disease progresses to more advanced stages. As the condition worsens, you may experience swelling or edema in your legs, ankles, or abdomen. This swelling occurs due to fluid retention, which is a result of the liver's decreased ability to produce substances that regulate fluid balance in the body. Number 6. Mental confusions. If you have severe liver damage, then it can affect the proper function of your brain as well, which can cause confusion, memory problems, and difficulty concentrating. This condition is known as hepatic encephalopathy. As per a study published in the Journal of Hepatology, an important sign of fatty liver disease is the development of hepatic encephalopathy, a condition in which severe liver damage leads to the accumulation of toxins in the brain, resulting in symptoms like confusion, memory problems, and difficulty concentrating. This can lead to different neurological symptoms in patients with advanced liver disease. So, these are some of the most prominent symptoms of fatty liver disease. Now, what should you do if you have fatty liver disease? Let's move on to the treatment options you have in hand for curing your fatty liver disease. Number 1. Lose weight. The first thing you should do if you have fatty liver disease is to lose weight. Remember that it is one of the most effective ways to reduce the excessive fat in your liver. In fact, a study suggests that a 5 to 10% reduction in body weight significantly improves liver health in individuals with non-alcoholic fatty liver disease. This is because weight loss can reduce fat buildup in the liver, improve liver function, and lower the risk of further complications. So, aim for a gradual weight loss of 1 to 2 pounds per week, and don't go for rapid weight loss as it can worsen your liver damage. For this, you can opt for doing around 150 minutes of physical workout in a week, or simply walking 10 minutes after each meal and eating healthy foods like fruits, vegetables, and whole foods instead of processed foods and foods high in sugars and fats. Number 2. Improve your diet. As you know, the diet you eat every day has a great impact on your fatty liver disease. So, you should focus on a diet that is rich in fruits, vegetables, whole grains, and lean proteins. You should opt for the Mediterranean diet in particular. This diet has significant impacts on reducing liver fat and improving liver function. In fact, a famous research study suggests that following a Mediterranean diet significantly reduces liver fat by up to 20% in individuals with non-alcoholic fatty liver disease. So, to maintain your liver health, cut back on saturated fats, refined sugars, and processed foods. Instead, opt for healthy fats like those found in olive oil, nuts, and fatty fish, which are high in omega-3 fatty acids, and they will help you a lot in reducing the effects of your fatty liver disease. Number 3. Exercise regularly. As mentioned earlier, physical activities can also help you in the reduction of your liver fat in many ways and improve your insulin sensitivity. So aim for at least 150 minutes of moderate intensity exercise per week. You can go for any set of exercises as per your body and weight. Some of the best exercises that can help you more with your fatty liver disease are brisk walking, swimming, and aerobic exercises. Number 4. Control blood sugar and cholesterol. Your blood sugar and cholesterol levels have significant impacts on your fatty liver disease. So, it is very important for you to manage your blood sugar levels and cholesterol. For this, you can avoid foods high in sugars and fats and opt for healthier options instead. Number 5. Avoid alcohol. If you have alcoholic fatty liver disease, even if you have non-alcoholic fatty liver disease, you should quit alcohol as soon as possible. This is because alcohol can cause alcoholic fatty liver disease or worsen your liver damage. Number 6. Get enough sleep. To improve your liver health, it is also essential to get enough sleep regularly. This is because poor sleep is linked to an increased risk of developing fatty liver disease. A famous study published in the Journal of Hepatology suggests that insufficient sleep is associated with a higher risk of developing non-alcoholic fatty liver disease. After adjusting for age, exercise, fasting plasma glucose, and body mass index, the group with long sleep duration showed a decreased risk of non-alcoholic fatty liver disease in men. So, get 7 to 9 hours of quality sleep each night. This will keep you active and will support your overall liver's health. Number 7. Consult specialists. If after following these healthier lifestyle tips, you do not feel any improvements, or especially if the disease progresses or complications arise, consult a hepatologist or a liver specialist as soon as possible. They can assess your condition and recommend appropriate medical treatment options. So that's it, the symptoms, causes, and treatments of fatty liver disease. Thanks for watching. If you found this video helpful, please like it and subscribe to our channel for more informative content. See you in the next video.